Welcome to the recorded webinar on monitoring requirements in the Child and Adult Care Food Program, or CACFP. This training is designed to provide new and existing CACFP sponsoring organizations with detailed information on their responsibility to provide monitoring oversight related to the CACFP and the supporting documentation that must be maintained to support these efforts. This applies to both child care and adult daycare facilities, as well as sponsors of the at-risk after-school meal component of the CACFP and family daycare home sponsors. CACFP regulations outline monitoring requirements for various stakeholders involved in the operation and administration of the program. These requirements apply to state agencies, such as RIDE, who are required to monitor all CACFP sponsors, including both announced and unannounced visits, at least once every 3 years, independent child or adult care centers, who must ensure that they employ sufficient staff to provide oversight for the program, and sponsoring organizations who have more than one affiliated facility under their CACFP agreement or who have at least one unaffiliated facility under their CACFP agreement, and are responsible for providing adequate supervisory and operational personnel for the effective management and monitoring of the program according to CACFP regulation. As you can see from this slide, there are no formal monitoring requirements outlined for independent centers, as generally administrative staff are working on-site in the program and are providing oversight on a daily basis. For sponsoring organizations, however, administrative staff are not necessarily on-site daily, and therefore formal monitoring requirements have been established. These requirements, which include the creation of a program management plan, minimum staffing levels, training of monitors, frequency and documentation of monitoring visits, and household contacts, will be the focus of the remainder of this presentation. Independent centers may choose to adopt certain monitoring standards as a best practice for ensuring program compliance, but it is not required. As part of the CACFP application and renewal process, sponsoring organizations must demonstrate that they have the administrative capability and capacity to perform monitoring activities in accordance with program regulations. The development of a monitoring plan is an important internal control that demonstrates a sponsor's accountability and commitment to maintaining program integrity. Any person outside of your organization should be able to read your CACFP monitoring plan and understand the expectations surrounding how monitoring will be conducted, overseen, and documented. As you think about your organization and its monitoring efforts, consider the following questions. Who within the organization will conduct monitoring visits? What are the qualifications for being a CACFP monitor? How will monitors be trained? How often and on what schedule will monitoring be conducted? Who will oversee the monitoring process? How will monitoring efforts be documented? When will follow-up to monitoring visits, including the initiation of household contacts, be required? And finally, what will happen if ongoing noncompliance is documented? Now let's look at each of these topics a little bit more closely. The first step to developing an effective CACFP monitoring plan is to identify who within your organization will be responsible for conducting monitoring visits. Most organizations will not have any one position that is solely dedicated to CACFP monitoring, so it is up to each organization to determine which staff member will be assigned to this task. Larger organizations do have specific staffing levels that must be met for program monitors as shown on the screen. For sponsors of centers, at least one full-time equivalent monitor must be employed for every 25 to 150 participating CACFP centers. For family daycare homes, one full-time equivalent monitor must be employed for every 50 to 150 participating home providers. Monitoring duties can be split across multiple positions as long as the minimum of one full-time equivalent worth of hours is dedicated to program monitoring and is appropriately documented as such. Whoever the organization assigns to program monitoring duties must be adequately trained on the program requirements that they will be monitoring. Training for monitors must occur upon hire and at least annually thereafter and must be documented according to CACFP training requirements. Lastly, a staff member who has daily responsibilities at any given facility cannot be responsible for the monitoring of their own facility. An example of this would be for a sponsor who has multiple affiliated daycare centers, each with their own center director. While the center director may seem a natural choice for assigning monitoring responsibilities because they are present and responsible for the program on a daily basis, a center director cannot be responsible for the formal monitoring process at the center that they are assigned to, as they are not likely to pick up on areas that might need improvement for an operation that they are in charge of on a daily basis. Center directors can, however, cross-monitor each other's centers if that fits within the organization's monitoring plan and each center director has been appropriately trained. Now that you've identified who is going to conduct monitoring visits, you will need to develop a monitoring schedule that meets regulatory requirements for the frequency of monitoring. Sponsors must conduct monitoring visits for any potential new site that will be brought onto the program, any newly participating sites, and for all other sites under the sponsor's CACFP agreement. Pre-approval visits are relatively informal and allow sponsors the opportunity to assess whether a facility or home is equipped with the resources needed to effectively participate in the program. These visits will be conducted using the RIDE-provided pre-approval visit form. Once a facility or home has received a pre-approval visit and has been formally brought onto the program, a sponsor must conduct a formal monitoring visit within the first 4 weeks of program participation. This type of visit will be conducted using the full program monitoring form as provided by RIDE and must include all review areas included on the form. Note that each type of CACFP sponsor will have a different monitoring form depending on the program in which they are participating. Forms are slightly varied for adult daycare centers, child care centers, at-risk programs, and family daycare homes. For newly participating facilities, the first monitoring visit conducted within the first 4 weeks of program participation will also count as the first of the 3 required annual monitoring visits. All facilities or homes under a sponsor must be monitored through a formal, documented monitoring visit at least 3 times annually, with 2 of the 3 visits being unannounced and no more than 6 months lapsing between visits for any one facility. At least one of the unannounced visits must be conducted during the meal service, but we highly recommend that a meal service is included as part of every review if possible. The same formal monitoring forms mentioned for the new facility visits will also be used for all formal and documented monitoring visits. In addition to meeting the frequency requirements as outlined in the previous slides, there are some additional considerations that sponsors should take into account when developing a monitoring schedule. First, monitoring visits must represent a variety of meal periods that a facility or home is approved for. For example, if a center is approved for shift feeding and serves breakfast, lunch, PM snack, and supper, it would not be sufficient to conduct monitoring visits only at breakfast. If your organization is unable to provide monitoring oversight for a specific meal period, then you should not be approving for facilities for participation in that meal. For example, if your monitoring staff works on a strictly 9-to-5 schedule, then you should not be approving facilities to participate in an evening snack or dinner service beginning after 5 p.m., as you do not have the capacity to provide oversight for this program. Similarly, meal service that should not be approved for days such as weekends or holidays for which monitoring staff are not available to provide oversight. The next consideration is to ensure that the timing of monitoring visits is varied. This applies not only to days of the week and meal periods as discussed above, but also to the time of the month when monitoring is conducted. If your staff always conducts monitoring visits on the first Tuesday of the month, site-level staff will begin to pick up on this pattern, and unannounced visits may not provide a true overview of program operations. Once you've established when to conduct monitoring visits, you must ensure that monitors are scheduled for enough time to complete a full and thorough review. A monitoring visit should include some pre-work that allows the monitor to review any issues identified in previous visits, enough time for monitors to be on site for the entire approved meal period to be reviewed, and sufficient time for monitors to debrief with site-level and sponsor-level staff as necessary. A monitoring visit is a great time to provide training and technical assistance to site-level staff, and more importantly, staff cannot begin to fix identified issues unless they are made aware of them. Monitors should always plan time to review the results of a monitoring visit, including leaving a copy of the monitoring report with site-level staff. Depending on your organization's structure, a monitor may also need to debrief with staff at the sponsor level on the results of a monitoring visit so that follow-up can be conducted as necessary. When developing your monitoring plan and schedule, keep in mind that certain issues noted during monitoring reviews may require monitoring staff to go back on site to conduct a follow-up review. You will need to have some flexibility to ensure that follow-up reviews can be conducted as necessary. As I mentioned earlier in this presentation, RIDE has developed monitoring forms separated by sponsor type, which are required for use in all formal monitoring visits. These review forms are designed to meet all regulatory monitoring requirements and must be completed in their entirety as part of every monitoring visit. Review topics will include meal patterns, licensing or approval, attendance at training, meal counts, menu and meal records, enrollment, and the 5-day reconciliation. The 5-day reconciliation process will include a comparison of meal counts, enrollment, and attendance for a 5-day operating period leading up to the day of review and must be completed as part of every formal program monitoring visit. Prior to beginning any monitoring review, it is important for monitors to review past reports to check on progress for any previously noted issues, as well as to check for any inconsistencies in operations from one review to the next. Some sponsors may have additional areas of compliance that they would like monitors to review during CACFP monitoring visits. This is acceptable as long as all questions included in the RIDE provided monitoring form have been answered. If you plan to edit the RIDE provided form to meet your organization's specific monitoring needs, you must submit the edited form to RIDE for approval prior to use. Remember, the monitoring process is essential to program integrity, which is why it is so important for this process to be well documented. Failure to document monitoring visits means that the sponsoring organization as a whole has failed to demonstrate the administrative capacity and capability to effectively manage the program and may jeopardize their participation in the program. Alternately, documentation that is incomplete or inaccurate may also adversely affect a sponsor's participation in the program. For instance, there are certain issues, such as license capacity violations, that affect the imminent health and safety of participants and must be immediately reported. Other violations, such as meal pattern compliance issues, may result in required disallowance of meals when submitting the monthly claim for reimbursement. If issues such as these are documented on a monitoring form with no additional follow-up, RIDE must assume that the sponsor does not understand program requirements or does not have the capability to effectively manage them. In either case, this would be a red flag for the state agency and would require follow-up. The goal of CACFP monitoring visits is to ensure that program integrity is maintained and that all program standards are being met. As we discussed earlier in the presentation, it is not enough for monitors to just note an issue. There must be a path to correction. All issues of noncompliance noted during a monitoring review should be addressed through a written plan of corrective action by the facility. In some cases, however, the sponsor may wish to conduct a follow-up visit to ensure that corrective actions have actually been taken. It is up to the sponsor to determine if and when a follow-up review outside of the next scheduled monitoring visit is required, but there are some situations in which a sponsor is likely to want to follow up sooner rather than later. These issues might include failure of the facility to maintain required records or failure of the facility to meet meal pattern requirements. Both of these issues could have significant financial implications for a program and would need to be addressed ASAP, so a sponsor may wish to spot check a facility to ensure that corrective action has been implemented. Though these two issues would likely warrant a follow-up visit, they are not the only situations in which follow-up visits might be needed. Sponsors should develop their own list of criteria to determine when a follow-up visit is needed, but the list of serious deficiencies shown on the screen would be a good starting point for developing follow-up procedures. Note that if any of the serious deficiencies shown on the screen are noted during a monitoring review, then the next monitoring visit must be conducted as an unannounced review. Family daycare home sponsors who note serious deficiencies that are frequent and severe may be required to initiate the serious deficiency process for the troubled provider. The use of this process will be covered in a separate training. Sponsoring organizations of centers should be aware that currently regulations do not provide a process for declaring an individual facility, as opposed to a daycare home, under a sponsoring organization as seriously deficient. This means that serious deficiencies that are frequent and severe at any one sponsored facility may jeopardize the overall sponsoring organization's participation in the program. The last item to take into consideration when conducting follow-up visits is documentation. If a sponsor elects to conduct a follow-up visit but does not conduct a full formal monitoring review at that time, then there is no specific form that is required for documentation, but it is still important that the sponsor maintains something to support their efforts. Sponsors may develop their own forms for documenting follow-up or other technical assistance visits, or they may simply choose to attach a notes page to the monitoring report that prompted the follow-up review. No matter how you choose to maintain this documentation, you want to be sure that the state agency can validate your efforts to demonstrate your commitment and capability to maintaining program integrity. There are certain issues noted during monitoring visits that may require follow-up outside of a physical follow-up visit. An additional method of follow-up that may be required is the use of household contacts. Household contacts can be used to verify that a provider or center's attendance and meals records are accurate and can help explain problems in record keeping or other situations that might cause you to question a claim. Per regulation, it is up to each state agency to develop a set of policies and procedures surrounding household contacts that are to be used by sponsoring organizations in the state. RIDE's household contact policy outlines the specific situations in which household contacts are required, as well as the steps that must be taken to conduct the household contact process. The list on the screen is not all-inclusive of situations that may require household contacts, but represents common issues that might be noted during a monitoring review that would require the use of the household contact process, including meal counts that are inconsistent with attendance records, meal counts and attendance that are inconsistent with information on the CACFP enrollment form, a large number of weekend, night, and/or holiday meals and snacks being claimed, prior days meal counts and/or attendance are much higher than the meal counts and/or attendance on the day of review, meal counts do not vary for multiple consecutive days. During a review, it is determined that meal counts being recorded may not be justified based on the attendance or enrollment, or meal counts show an unusually high number of meals for more than one day in a claiming period. Any of these issues that raise a concern with the validity of the enrollment, attendance, and/or meal service, participation of children in childcare, or adults in care would be cause to initiate the household contact process. As with each of the monitoring steps discussed during this presentation, be sure to maintain documentation to support the use of this process. Now that we know who will be conducting monitoring, what the qualifications for monitors are, and how often monitoring must be conducted, sponsors should identify how this process will be managed. You want to trust the staff that you've hired, but you should have a process in place to verify that expectations are being met. Who will be responsible for ensuring that monitors are completing required visits, that monitoring forms are filled out completely, and that follow-up is conducted as necessary? The person responsible for monitoring the monitors will likely vary by organization. For example, if you're sponsor centers and you have your center directors perform cross-monitoring, it may be the owner or even the board chair who verifies that monitoring is being conducted according to plan. In a situation where you are the highest person within your organization and you have chosen to conduct monitoring yourself, you may establish a process like reviewing your monitoring schedule monthly or having your director track your monitoring efforts via spreadsheet to ensure that everything is going according to plan and that nothing falls through the cracks. When creating a monitoring plan, if you refer to specific staff members in the plan, be sure to use titles rather than names to account for potential staff turnover. As with all CACFP requirements, and as we've talked about throughout this presentation, documentation is key. If you don't document your efforts, it's like it never happened. At a minimum, sponsors must maintain copies of complete monitoring reports using the RIDE-provided monitoring forms, documentation of any follow-up visits or corrective action plans, and documentation to support the implementation of household contacts as necessary. Some sponsors may choose to track monitoring efforts by site via spreadsheet. This should be indicated as part of your overall monitoring plan. Once you've determined how you will document monitoring efforts, you should identify where monitoring records will be stored. As with all CACFP documentation, monitoring records must be maintained for a minimum of 3 years plus the current year and must be available for review by RIDE staff at all times. There is no specific requirement on how monitoring documentation is maintained, but you may want to consider how accessible this information needs to be when determining a record-keeping system. RIDE will request all monitoring reports for all sites from a 1-year period at the time of review. If all monitoring visits have not been conducted for the year at the time of review, RIDE staff may ask for prior year records as well. If your record-keeping system includes a variety of methods and/or locations for storing records, such as a filing box for copies of paper monitoring reports, as well as an electronic spreadsheet used for tracking, be sure to note this in your monitoring plan. Internal controls, such as developing a CACFP monitoring plan, are an important part of maintaining program integrity, but policies and procedures are only as important as we make them. As a best practice, it is recommended that sponsors use the RIDE-provided CACFP monitoring policy and procedures template to help them plan for success in meeting CACFP monitoring requirements. Throughout this presentation, we have covered the minimum requirements as they relate to monitoring, but sponsors are encouraged to maximize monitoring efforts by explaining what you are doing and why to employees that you interact with on monitoring visits, ask centers or providers open-ended questions to learn the most about their actual practices, act on teachable moments. Monitoring is a great chance to provide additional training and technical assistance to on-site staff. Make it meaningful. Not only do you want to be prepared and have enough time for monitoring visits, but while on site, you want to get the most out of your experience. So be sure to ask yourself what each question on the monitoring form is really trying to get at. See meal service whenever possible as part of your monitoring visits. Monitor as frequently as you are able, and use past monitoring reports to help you develop staff training sessions. Monitoring shouldn't be seen as a chance to say gotcha to providers or centers, but rather as an opportunity to learn where there are areas for improvement and what additional training might be required. The operation and administration of the CACFP is a partnership among various levels of staff, and monitoring is just one tool that can be used to ensure that partnership remains strong and that everyone is on the same page. This concludes today's presentation on CACFP monitoring requirements. To access any templates or forms referenced during this training, please visit the RIDE Child Nutrition Program's website at the link found on the screen. If you have any questions related to this training or other CACFP topics, please contact your RIDE program specialist or email our general child nutrition inbox at the email address found on the screen. Thank you.